Which one of the following types of suture material is absorbable? Catgut. The minimum number of cells to be counted in a differential blood smear is 100. A hemoglobin of 10 grams per deciliter is approximately equivalent to a hematocrit of 30%. Which of the following lab results should be called to the attention of the physician? SID rate 30 mm per hour. The stain used to identify bacteria is the Gram stain. On standing for a long time, a urine sample becomes alkaline. Which of the following are categories to classify instruments used in surgery? All of the above. The first thing that should be done in an emergency situation involving an unconscious person is to assess victim's airway. A physical examination of a urine sample includes all of the above. Most drugs are metabolized in the liver. The Ishihara test. Tests for color blindness, which is not a common symptom of a myocardial infarction. Polyuria. Hemostats are a type of forceps. The normal ratio for respiration to pulse is 4:1. Symptoms of insulin shock include all of the above. Which is the most important route for the elimination of drugs from the body? Kidney. Prozac is an example of an antidepressant. The two most important factors in performing an effective hand wash are friction and running water. At which age is the first MMR vaccination recommended? 12 months. If a patient describes an aura before the onset of a severe headache, this is often a sign of a migraine. A function of hemoglobin is to carry oxygen and carbon dioxide. A quality assurance program in a lab ensures the accuracy of results. The reaction of the PPD test is read 48 to 72 hours after it is administered. The abbreviation for both ears is AU. The blood type known as a universal donor is O. A lower GI series is performed to outline the colon. A technique that provides soft tissue images in 3 dimensions is CT scan. Massive and prolonged exposure to radiation can result in cancer. The first group of leads to be recorded on an EKG are leads I, 2, and 3. Streptococci are arranged in chains. Pulse rate may be increased in all of the following except increasing age. The electrode that is used for grounding in an EKG is RL. Which federal agency oversees the safety of health facilities? OSHA. A drug reference contains all of the following information except cost. Ibuprofen has analgesic and antipyretic properties and is used to treat all of the above. Which of the following patient instructions is critical for successful Holter monitor recording interpretation? Keep a written recording of all daily activities. The involuntary muscular action that moves food along the GI tract is called peristalsis. The first dose of DTP vaccine should be administered at 2 months. A ligament connects bone to bone. Tissue samples removed during a biopsy would be sent to which department of the lab? Histology. Which of the following would be least likely to contaminate the sterile field? Non-sterile person entering the room. An antihistamine that may be used to treat an allergic reaction is Benadryl. Each of the following abbreviations is correctly defined except caught every day. Surgical asepsis should be maintained when performing which of the following? Needle biopsy. How often should quality control tests be performed in the lab? Daily. This type of nerve conducts impulses toward the brain. Afferent. Sweat glands are termed pseudophorus glands. An infectious inflammatory skin disease caused by Staphylococcus and characterized by vesicles that later crust is called impetigo. A decrease in bone density may indicate osteoporosis. The largest portion of the brain is the cerebrum. An impairment of vision due to old age is presbyopia. An infection of the middle ear may be charted as otitis media. The valve located between the right atrium and left ventricle is the tricuspid. The medical term for whooping cough is pertussis. The region between the lungs that contains the heart, aorta, esophagus, and bronchial tubes is the mediastinum. Inflammation of the nasal mucosa results in rhinitis, a disease that is characterized by muscle rigidity, a shuffling gait, and progressive tremors is Parkinson's disease. Which of the following accessory organs of digestion stores and concentrates bile? Gallbladder. Micturition is a synonym for urination. Which of the following indicates an aggravation of symptoms? Exacerbation. A woman who has given birth to 2 or more children may be called multipra. The release of an ovum from the ovary is ovulation. Male sterilization is vasectomy. Which of the following are ways in which pathogens can be spread? All of the above. The colored portion of the eye is known as iris. All of the following are bones of the middle ear except the pinna. The combining form for bone is osteo. Slow heartbeat is also called bradycardia. A temporary absence of respiration is apnea. A collection of blood in the pleural cavity is called a hemothorax. An endoscopic examination of the rectum is charted as a sigmoidoscopy. The downward projection from the lower edge of the soft palate is the uvula. The combining form labio means lip. The hollow, muscular organ that temporarily stores urine in the urinary bladder. The secretion from an endocrine gland is called a hormone. Progesterone is produced by the corpus luteum. The region between the vagina and anus is termed the perineum. Which of the following is not a part of the axial skeleton? Scapula. A wound that barely penetrates the skin is charted as being superficial. A surgical opening into the eardrum to avoid rupture is a myringotomy. An antipyretic agent works against fever. Rhinorrhea. Flow or discharge from the nose. Stasis. To stop or control. Splenomegaly. Enlargement of spleen. Steno. Narrowing. Stomy. Forming a new opening. Subpulmonary. Below the lungs. Tenodynia. Painful tendon. Thrombectomy. Surgical removal of blood clot. Tympano. Eardrum or drum-like. Unilateral. On one side. Transthorax. Across the chest. Vaso. Vessel or duct. Pexy. Suspension or fixation. Abortion. Termination of pregnancy before viability. Rhexis. Rupture of a vessel, organ, or tissue. Hypoglycemia. less than normal blood sugar. 9 quadrants in a human body are cranial, spinal, dorsal, thoracic, diaphragm, abdominal, ventral, pelvic, and abdominopelvic. The human body has 206 bones, cartilage, and ligaments. The framework of the body is the skeletal system. Alplasia, lack of formation or development, usually refers to organ. 12 pair of bones that make up the thorax, the bars of the cage, ribs. Lordosis, excessive curvature in the lumbar portion of the vertebral column. Scoliosis, abnormal lateral curvature of the vertebral column. A tort is a type of civil law. Malfeasance is one form of malpractice. Kyphosis, an excessive curvature in the thoracic portion of the vertebral column. AIDS, decreased immunity resulting from infection with the human immunodeficiency virus, leaving the victim susceptible to opportunistic diseases. Tachycardia, increased heart rate. Muscular system, contains approximately 650 muscles at form of the body. Mammoplasty, surgical reconstruction of the breast. Meningocele, herniation of the meninges. Lymphadenitis, inflammation of the lymph glands/nodes. Inter, between in the midst. Dyskinesia, difficult or painful movement. Malacia, softening of the tissues. Myco, fungus or mold. Vaso, vessel or duct. Arthritis, ARTHRO, inflammation of the joints. Itis, inflammation. Rhinorrhea, flow or discharge from the nose. Anteroposterior, passing from front to rear. Anterior, front of the body. Dactylo, digit, finger, or toe. Cytology, study of cells. Cystitis, bladder inflammation. Cholecystitis, inflammation of the gallbladder. Cyanosis, bluish condition of the skin. Gyroplasty, surgical repair of the hands. Cervicofacial, pertaining to the face and neck. Cardiomegaly, enlargement of the heart. Bradycardia, slow heart rate. Hemiplegia, paralysis of the one half of the body. Gynecopathy, any disease of the female reproductive system. Nasopharyngeal, pertaining to nose and throat. Metrorrhexis, rupture of the uterus. Absorption, the transfer of the products of the digestion into the blood and lymph for circulation. Homeostasis, suppression of the menses. Posterior, back of the body. Pneumo, air. Peri, a roundabout. Adrenomegally, enlargement of the adrenal glands. Adenoma, tumor of gland. Abdominocentesis, surgical puncture of the abdomen to remove fluid. Neuralgia, pain in nerves. Onchocryptosis, an ingrown nail, finger or toenail. Neurotripsy, surgical crushing of a nerve. Logi, the study of. Necrosis, death of tissue or bone. Nephrolysis, destruction of the kidney tissue. Intracerebral, within the main part of the brain. Intravascular, within a vessel. Nephropathy, disease of kidney. Laparotomy, incision of the abdominal wall. Lipectomy, excision of fatty tissues. Leukopenia, decreased white cells. Onychomycosis, condition of fungus of the nails. Oophorectomy, excision of an ovary. Lipolysis, destruction of a stone. Prefix, beginning of the word, it modifies the root. Nervous system, regulates body functions and processes, communicates stimuli and responses throughout the body, generates thoughts, sensations, emotions, and perceptions. Chemicals, atoms and molecules. Suffix, ending of the word, it modifies the root. Root, meaning or central part of word. Organ, group of tissues working together to perform a function. Tissues, groups of cells with similar structures and functions. Cells, structural and functional units of life. Lysis, destruction, destroy and dissolution. Pneumono, lung. Phonia or phono, voice. Phago, ingest or eat. Algesa, pain or sensitivity to pain. Hyperplasia, excessive formation of cells or tissue. Gingivoglossitis, inflammation of the gums and tongue. Gastritis, inflammation of the stomach. Gastroctasia, stretching of the stomach. Enteritis, inflammation of the small intestine. Endocarditis, inflammation of the inside lining of the heart. Encephalitis, inflammation of the brain. Amia, pertaining to the blood. Dyspepsia, indigestion or painful digestion. Gastritis or gastro, inflammation of the stomach. Neuropathy, disease of the nerves. Ragia, burst forth or hemorrhage. Lateral, side of body. Medial, middle of body. Duodenscopy, inspection of the duodenum with a scope. Homeostasis, the equilibrium or health of the body as measured by established norms for blood pressure, heart rate, temperature, resp rate, and other indicators. Skeletal system, bones and related structures that support. Muscles and related structures that accommodate movement. Muscular system. Dextro, right. Dermatosis, any skin lesion or eruption. The study of body structure. Anatomy. The study of body function. Physiology. The study of abnormal changes in body structures or functions. Pathology. Skin and related structures that contain and protect. Integumentary system. A group of organs working together to perform a set of related functions or systems. Dacryocystitis, inflammation of a tear sac. Cytoscopy, microscopic examination of cells. Abduction, moving away from the body midline. AB, away from, absent. Orchid, testicle. Orchidectomy, surgical removal of the testicle. Osteoarthropathy, disease of joints and bones. Osteocyte, bone cell. Pepsis, digestion. Fulparexis, rupture of a vein. Proctoragia, hemorrhage of the rectum. Piloplasty, surgical repair of the renal pelvis. Arteriosclerosis, thickening of the arteries. Antipyretic. Against fever, fever-reducing. Analgesia. To take away pain, free from pain. Homeostasis. Control bleeding or to stop bleeding. Auto. Ear. Algia. Pain. Otalgia. Ear pain. Posteromedial. Middle of the back or middle of the backside. Hypothermia. Below normal temperature. Retinopathy. Disease of the retina. Pyogenesis. Formation of pus. Hepatomegaly. Enlargement of liver. Hysterorrhapy. Suturing of the uterus. Acrocyanosis. Blue condition of the extremities. Retroperitoneal. Behind the peritoneum. Proper interaction with pediatric patients includes the following except telling a child that a procedure will not hurt at all. The salutation of a letter is placed 2 lines below the inside address. A urine test that compares the weight of urine to that of distilled water is specific gravity. The ECG lead that measures the difference in electrical potential between the right arm and left arm is lead eye. Intra. Within. Sub. Beneath, below, or under. Litho. Stone. Gingivoglossitis. Inflammation of the gums and tongue. Laparotomy. Incision of the abdominal wall. Dice. Difficult or painful. Kinesio. Movement or motion. Ia. Pertaining to. Dyskinesia. Difficult movement. Adeno. Gland. Oma. Tumor. Adenoma. Tumor of the gland. Pathy. Any disease. Gyneco. Female. Pyogenesis. Formation of pus. Hyperplasia. Excessive formation of cells or tissue. Hemi. Half, 1/2. Plegia. Pertaining to paralysis. Spinal cavity. Contains the spinal cord, runs continuously from the brainstem in the cranial cavity to the end of the spinal cord. Cranial cavity. Contains the brain. Thoracic cavity. Contains the heart, lung, and large blood vessels. It is separated from the abdominal cavity by the diaphragm. Within the thoracic cavity lies the mediastinum, a smaller cavity between the lungs that contains the heart and large blood vessels. Abdominal cavity. Contains the stomach, most of the intestines, the kidneys, liver, gallbladder, pancreas, and spleen. It is separated from the thoracic cavity by the diaphragm and from the pelvic cavity. Pelvic cavity. Contains the urinary bladder, rectum, and internal organs of the male and female reproductive system. The body contains different types of found in the diverse organs and systems. Tissues. The study of tissue is called histology. Forms the outer surface of the body. Epithelial tissue. Squamous, cuboidal, or columnar. Cells. Simple or stratified. Layers. Supports and connects other tissues and structures. Connective tissues. Produces movement. Muscular tissue. Blank are thin sheets of tissue that line and protect structures. Membranes. The thoracic and abdominal cavities of the body are separated by the diaphragm. The main tissue of the outer layer of the skin is epithelial membrane. The glands that are sac-like in structure and produce oily secretions that lubricate the skin are sebaceous. The portion of skeletal bone that manufactures blood cells is the Red bone marrow. The structure that attach muscles to bone are tendons. Nerve fibers are insulated and protected by a fatty material called myelin. The function of the lacrimal apparatus is to produce tears to lubricate the eye. A bone that is part of the pelvic girdle is the ischium. The cellular components of blood include erythrocytes, leukocytes, and platelets. The chambers of the heart are the ventricles and atria. An organ located in the left upper quadrant is the spleen. An example of active immunity is producing antibodies as a result of having a disease. The structure in the body also known as the voice, larynx. The wave-like movement that propels food through the digestive tract is called peristalsis. The process that does not require oxygen for the breakdown of glucose is referred to as being anaerobic. The term that means the body is in a state of equilibrium or balance is metabolism. The funnel-shaped basin that forms the upper end of the ureter is the renal pelvis. In both males and females, the entire pelvic floor is called the perineum. A pregnancy that develops in a location outside the uterine cavity is referred to as ectopic pregnancy. Which of the following body systems includes the thyroid and pituitary glands? Circulatory. The term inguinal pertains to what area or structure of the body? Groin. The measure of acidity or alkalinity of solution is called telephone. The thoracic and abdominal cavities of the body are separated by the diaphragm. The main tissue of the outer layer of the skin is epithelial. The chambers of the heart are the ventricles and atria. An example of active immunity is producing antibodies as a result of having a disease. The structure in the body, also known as the voice box, is a larynx. The wave-like movement that propels food through the digestive tract is called peristalsis. The process that does not require oxygen for the breakdown of glucose is referred to as being anaerobic. The term that means the body is in a state of equilibrium or balance, homeostasis. The funnel-shaped basin that forms the upper end of the uterus, renal cortex. In both males and females, the entire pelvic floor is called perineum. The measure of acidity or alkalinity of a solution is called pH. A term that describes a solution that has the same concentration as cell fluids is isotonic. The fibrous bands that support organs to hold them in place are fascia. The membrane that surrounds the heart is the pericardium. The small tip of the cartilage at the lower end of the sternum is the xiphoid process. A major muscle in the body that assists in raising the arm away from the body is the sartorius. Cells that carry or transmit impulses toward the central nervous system are called afferent neurons. The spaces in the brain where cerebrospinal fluid is formed are the ventricles. Impulses from the receptors for smell are carried to the brain by the olfactory nerve. The hormone that is essential for growth is produced in the pituitary gland. Which of the following represents layers of the heart? Epicardium and myocardium. The blood vessel that brings blood from the head, chest, and arms back to the heart is the superior vena cava. Which of the following is the proper sequence for the flow of blood in the body? Artery, vein, arteriole. The condition and inflammation of the lymphatic vessels is called lymphangitis. The lymphatic system includes the following organs and tissue except Hypothalamus. The process in which white blood cells take in and destroy waste and foreign material is called phagocytosis. The structure common to the respiratory and digestive systems is the pharynx. An accumulation of air in the pleural space that may lead to collapse of the lung is called pneumothorax. The leaf-shaped cartilage that covers the opening of the larynx is the epiglottis. Most of the digestive process occurs in the small intestine. The lining of the stomach has many folds called rugae. The first portion of the small intestine, duodenum. An accumulation of excessive fluid in the intercellular spaces is called edema. The kidneys are located in the retroperitoneal space. The term hydronephrosis means distension of the renal pelvis resulting from obstructed flow of urine. The sex glands of the male and female reproductive system are the testes and ovaries. The bone that lies between the hip and the knee is the femur. The largest artery in the body is the abdominal aorta. The term that refers to absence of menstrual flow in a woman of reproductive age is amenorrhea. The hormone produced by the embryonic cells of the fetus. Human chorionic gonadotropin hormone. A substance necessary for proper formation of a blood clot is thrombin. The left atrioventricular AV valve in the heart is also known as the mitral valve. The only artery in the body that carries deoxygenated blood is the pulmonary artery. A localized dilation resulting from weakness of a blood vessel wall is a aneurysm. An example of chronic obstructive pulmonary disease is emphysema. A portion of the large intestine is the sigmoid. A chronic degenerative disease of the liver is cirrhosis. The tube that permits urine to pass from the bladder to the outside of the body is the urethra. The innermost layer of the uterus is the endometrium. The frontal or coronal plane of the body divides the body into front and rear. The membrane attached to internal organs is the visceral layer. The term that describes a disorder that breaks down tissues in a body system is degenerative. The study of the cause of any disease or of all factors that may be involved in the development of a disease is etiology. The chronic skin condition characterized by a red flat area covered with silvery scales is psoriasis. Which of the following is not one of the cranial bones? Maxilla. The bone that is part of the shoulder girdle and is between the sternum and the scapula is the clavicle. The type of muscle responsible for producing peristalsis. Smooth. The type of joint motion that allows movement away from the midline of the body, such as moving the arms straight out to the sides, is abduction. The sympathetic system of the autonomic nervous system is responsible for dilation of bronchi of the lungs. The portion of the brain that aids in the coordination of voluntary muscle action is the cerebellum. Strabismus is a condition of the eye causing cross-eyed appearance. A structure found in the inner ear is the cochlea. The clusters of cells called the islets of Langerhans are located in the pancreas. A goiter is associated with abnormal function of the thyroid gland. The Rh factor in blood is an antigen that affects a person's blood type. The area of the heart that initiates a heartbeat is the sinoatrial node. A heart disease that is present at birth is congenital heart disease. Which of the following blood vessels is proximal to the heart? Ascending aorta. Acquired natural active immunity is achieved by contracting the disease. The human immunodeficiency virus is the cause of which disease? Acquired immunodeficiency syndrome. Which of the following statements is accurate about the lungs? The sac covering the lungs is the pleural sac. A communicable infectious disease of the lungs is tuberculosis. An example of inflammatory bowel disease is Crohn's disease. A form of gum disease in the mouth is Vincent's disease. A chronic malignant disease characterized by enlargement of the lymph nodes and spleen is a Hodgkin's disease. The fluid contained within the body cells is called intercellular fluid. Plasma is the liquid part of blood, and interstitial fluid is tissue found in spaces between cells. Isotonic means the same concentration of fluid inside and outside a cell. Two important electrolytes found in the body are sodium and potassium. Zinc and magnesium are minerals. Protein and carbohydrates are nutrients. Nitrogen and carbon dioxide are gases. A condition resulting from renal failure and causing high levels of blood urine nitrogen is uremia. The period of pregnancy is called gestation. The hormone that causes contraction of uterine muscle during labor is oxytocin. The region located directly below the umbilical region is the hypogastric region. An example of exocrine glands are sebaceous glands. The order of the vertebral column from top to bottom is cervical, thoracic, sacral, lumbar, coccyx. The muscle located on the anterior thigh and that functions to extend the leg is the quadriceps femoris. The artery located in the upper arm is the brachial artery. What arteries are located in the neck? Carotid artery. What artery is located in the armpit axillary area? The subclavian artery. Any foreign body substance that enters the body and induces an immune response is a antigen. An immunoglobulin, also known as an antibody, is a substance produced in response to an antigen. An enzyme is a protein produced in the body that causes a breakdown of food. A globulin is a protein in the blood associated with antibodies. The smaller leg bone lateral to the tibia is the fibula. The femur is the largest bone in the body is the thigh bone. The patella is the kneecap. Tarsals refer to any one of the 7 ankle bones. The small pouch that the first part of the large intestine is the cecum. The small intestine are parts of the jejunum, duodenum, and ileum. The region between the stomach and small intestine is the pylorus. The hormone that regulates the amount of water that is eliminated with urine is ADH, antidiuretic hormone. ACTH, adrenocorticotropic hormone E, stimulates the adrenal cortex to produce cortical hormones that aid in protecting the body in stress and injury. FSH, follicle-stimulating hormone, stimulates the growth and activity of the ovarian follicle. TSH, thyroid-stimulating hormone, stimulates thyroid gland to produce thyroid hormones. An excessive curvature in the thoracic portion of the spinal column. Kyphosis. Diabetic retinopathy is a result of damage to the eyes. Which of the following statements is true? Type 2 diabetes is non-insulin-dependent diabetes. Which of the following is protein found in a epidermis that makes the skin waterproof? Melanin. What is a protein found in the dermis that provides strength and flexibility? Collagen. What are hair-like processes that trap and move foreign particles? Cilia. What is the most common condition of the eye associated with aging? Presbyopia. What is a condition of farsightedness in which the distant objects can be seen more clearly than closer objects? Hyperopia. A condition causing impaired vision from an irregular curve of the cornea. Astigmatism. An inability of both eyes to simultaneously focus on a subject. Strabismus. Abnormal growth of blood vessels or other materials in the retina. Macular degeneration. What structure is at the neck of the bladder and surrounds the urethra? Prostate. The epigastric anatomical region of the abdomen is located distal to the sternum. Collagen, a substance found in the dermis, is a fibrous protein. Which of the following glands are located in the sides of the vaginal opening and produce mucus? Bartholin gland. The prostate and Cowper gland are glands associated with the male reproductive system. Endocrine glands have no ducts and secrete hormones directly into the bloodstream. When the foot is moved outward, the joint movement is abduction. Circumduction is moving in a circular motion. Flexion is bending a body part. Adduction is moving toward the body or inward. Extension is straightening a body part. The master gland of the body is the pituitary gland. A fracture of the radius characterized by bending of the bone with the skin left intact is referred to as green stick closed. Spermatozoa normally fertilize the female ovum in the fallopian tube. The glomerulus is a cluster of blood capillaries found in the nephron. The disorder characterized by uncontrollable episodes of falling asleep is narcolepsy. The regulation of body temperature is controlled by the hypothalamus. Which of the following is not a neurotransmitter? Aldosterone. Acetylcholine, norepinephrine, and epinephrine are all neurotransmitters. Cranial nerve 1, the olfactory nerve, is related to the sense of smell. A blood cell that carries oxygen and has no nucleus is an erythrocyte. During respiration, exhaled air contains primarily carbon dioxide. A condition causing backflow of the stomach acid through an incompetent esophageal sphincter is called GERD. Which of the following is the best example of nonverbal communication? Body language. When a person generalizes the behavior or characteristics of all members of particular culture, race, or religion, it is referred to as stereotyping. 3 elements necessary for basic communication include message, sender, and receiver. To have proper verbal communication with a patient, you should use conversation at the patient's educational level. Communicating with someone who is grieving the loss of a loved one is difficult when the person refuses to acknowledge the loss. This type of behavior is referred to as denial. To communicate with a sight-impaired patient, it is important to tell the patient each time before you touch him or her. To communicate with a hearing-impaired patient, it will be advisable to speak slowly and distinctly to the patient. Which of the following is an example of an open-ended question you would ask a patient? What day can you come in for a follow-up appointment? When communicating with a difficult, challenging patient, you should exhibit a diplomatic attitude. Which of the following is an example of behavior that demonstrates open nonverbal communication? Leaning forward to listen. When individual is overemphasizing certain behaviors to accommodate for real or imagined weaknesses, he or she is compensating. Maslow's hierarchy of human needs is based on the concept that physiological needs are the most basic but are necessary for a person to progress any further toward reaching self-actualization. When communicating with pediatric patients, you should not lie to a child but state the truth. The receiving and interpreting of a message is known as decoding. Psychological behaviors that protect a person from guilt and shame are defense mechanisms. When communicating with a non-English speaking patient, it is appropriate to use gestures to demonstrate information. Prejudice is a trend that means you hold an opinion or bias concerning an individual because of his or her affiliation with a specific group. To encourage further comments from a patient, the interviewer can repeat what the patient has said using open-ended statements that require the patient to respond. This technique is called reflecting. A patient who is withdrawn, weeping, and isolated from others may experiencing depression. Maintaining a professional relationship with the patient means that you should deliver patient care that allows you to continue to provide objective medical care. Proper flow of communication occurs in the following order: message, response, clarification, and feedback. Which of the following is an issue that becomes predominant during the adolescent stage of development? Self-image. To set the stage for successful communication, you should sit at the patient's level eye to eye and maintain eye contact with the patient if culturally appropriate. Communication techniques that are used when interviewing a patient include reflecting and summarizing. To avoid breaching confidentiality, you should avoid discussing patient problems in the office. To progression of a person's needs from basic survival to reaching one's pinnacle or self-actualization is known as Maslow's hierarchy. The 4 Ds: duty, derelict, direct cause, and damage. The Bill of Rights include the right to confidentiality. The Code of Hammurabi was written in 2500 BC. A living will is an advance directive stating the patient's decisions for medical care before an incapacitating event. The Good Samaritan Act was designed to encourage healthcare workers to stop at the scene of emergencies by protecting them from liability for civil damages. An abnormal